Welcome to the River Park Dental Show. This is Dr. Phing Saurer, and I'm here with Michael Morris.
It's good to be here, Doc. I was waiting to see if you're going to introduce me. I'm happy to be here again.
You always, give me a hard time about.
I love the introduction. It's like one of my favorite things we do.
Really?
Not really.
And should we just end it now?
Yeah, let's end on a high note. I think we should get into a topic today, though. And I think to get in this topic, we should say that we finished the show last week with Missy from your office. Mm-hmm. And a guy that I went to school with, Kevin Bricker. Kevin, if you're listening, the show is dedicated to you since this was your topic. He had mentioned this, and we had kind of conversed a little bit on the phone about it. The topic was how oral health and heart disease are connected. Now, I know that when Kevin was growing up, he'd had some heart issues when he was younger.
Sure.
And so I know he's very into this topic. And since he's a Grove City guy, we got to talk about Grove City guys, right? But what I wanted to do was talk about these two things because before we get into the nitty gritty, we are going to say these are not definitive studies. So there's still research going back and forth, right?
Yes, yes.
So what we're saying is not the end all be all of heart disease being connected to oral health. However, you had said all health is connected.
Yeah, all health is connected, and it's there's definitely a correlation between the two, and it is a risk factor, but I don't think that right now the American Heart Association and the American Dental Association has said that there's not enough evidence yet to say that it's causal. So it's just, but I think it's having it's being healthy. That's.
Well, the question I would have in that situation is they're not working together on those studies, right? They're doing two different studies.
There's a lot of studies that are going on. I mean, the reason why they've even thought this was something that was should be discussed is they found oral bacteria in the plaque with people that had cardiovascular disease. So they think that that's playing a role, which it may be. It definitely is maybe playing a...
Well, that's what I'm saying in a lot of the articles that I was researching is the plaque buildup is what they're worried about, and then it's getting somewhat ingested, so it's not getting out. That's why the cleanings are important.
Yes.
But that's not the end-all, be-all to this.
No, I don't think so. I think when I have had patients that have had issues, there's other things too. It's their lifestyle, genetics, their eating habits, their, trying to think of other things.
Well, I think you kind of nailed it there.
But periodontal disease is a long-term disease. It's not something that can be cured.
Periodontal is not?
No.
See, so now we're opening up a whole nother can. Well, keep going with that, but I kind of want to...
Well, So I think when people... So the initial way to fix periodontal disease is doing a deep cleaning or scaling root planing. So you're going down deep into the
to the root?
To the root of the tooth and really cleaning out the bacteria and the tissue. Now, granted, if it's really, really deep, you can't get down all the way. So, I mean, it has its limitations. And in those cases, then you have to go surgical and really go deeper by having...
the deepest of the deep, we could say.
It's surgery. You have to flap the tissue.
Of course you do.
And get down to the bone and really clean underneath there and then suture back up.
So that sounds like a really painful experience.
I mean, it's... you're numb when you're getting it done.
Well, of course you are. I know that part.
But, I mean, then there's healing, but you have the inflammation. You just had to get rid of it.
So let's back up because that is... Would you say that is worst case scenario of the treatment that you have to go through? For that amount?
Yeah.
Is that deep? Okay. When we're talking about the plaque buildup, because I think that's where Kevin was going, because he had mentioned on Facebook that's what he wanted us to cover.
Right.
And then another person had shared a link. And I should also say this before we get back into plaque. Everybody's holding on. They can't wait to hear about plaque. But if you have a topic that you would like us to discuss, you can always if you're on the Facebook page, go ahead and do that. Or
the Facebook page.
No, I said the Facebook page, not like the Facebook.
Oh.
Though I found myself for a couple of months doing that after seeing the movie The Social Network. I kept going, the Facebook.
The Facebook.
They peeled off
I still thought the Facebook.
But you're kind of new to Facebook.
I've been almost a year.
Yeah. Congratulations.
Thank you.
We're going to have a little party for that. But if you do have something you would like to talk about, you can
message us
on Facebook and we'll talk about it. But The issue with plaque. So when you're getting, I think a lot of people look at routine cleanings at every 6 months. You're supposed to come.
Yeah.
When you are treating someone, you can tell. We've talked about you can tell what they're eating for the most part, right? So I want to talk about plaque before I talk about lifestyle. So this plaque, how it's different in everybody, the amount that's building up, because that's what's kind of leading these studies is how much is getting into your body that's causing and I'm going to try to say this name, endocarditis.
Endocarditis.
There you go. That's what I meant to say. That's one of the things that this plaque
is
is getting in your bloodstream and causing these issues, right?
It's the bacteria.
So is it different in different people, the amount of plaque that they're getting? I know some of that can be hereditary, but what are you seeing when you're digging in there?
So people that have periodontal disease, one, they do have to come in more frequently. So the buildup occurs more regularly. So we usually recommend for every 3 to 4 months, depending on how severe it is. Versus 6. And then also we just, it's cyclic. It's so it's not something that you cure. So when they come in, you have to make sure some signs that you look for is bleeding, because that means that if there is bleeding, that's an active inflammation. Bleeding of the gums. And then you're also checking the level of tartar, the tissue, if it's red, if it's sometimes they become cyanotic, sometimes they just are really inflamed. So you really want to make sure that the tissue itself is nice, pink, firm, and the tartar level is under control. And then you can stabilize it. So we try to look for that stable when they are stable. But there are times when you can come in and that, they may be under a lot of stress, or, the bacteria starts coming back up and they have that inflammation again. So then we try to control that with the deep cleaning.
So that you're saying that that's something that is just naturally occurring in someone's body, so they have to treat it almost like any other disease.
There's a maintenance to it, yeah.
So lifestyle, you kind of touched on that. Nothing you can do lifestyle-wise changes that? Not changing eating habits, or, some people will be like, I'm cutting out all meat or all dairy, or I'm going to be, I'm going to go to, what is it, when they're doing just shakes? Like you can't really, that doesn't change it, right? Because it's not what you're eating that's going to adapt.
I mean, it's still a disease. So, you want to definitely try to stabilize it. So I think having a healthy lifestyle can contribute to it. But it's like people that have diabetes, they tend to, they have found that if you have diabetes and you take care of the periodontal disease and you can control the inflammation, that can make their diabetes a little bit better, their sugar levels. But there's a lot of things that are involved. I'm trying to think of. I
know you were leery about the topic because there's so much of it, and we only have half an hour to discuss it.
I know.
But I did want to touch on it because there are studies. So when we're looking at this research, it's kind of, you look at it and go, oh, there's definitely a correlation.
Yes.
But there's no proven end game to it. So there are correlations to it, but it doesn't mean that there's no.
It's not causal.
Right.
It's like the chicken or the egg, what came first.
Well, that's a perfect way to look at it. So,
right.
But I think it was important because we did have somebody that reached out and said they wanted to talk about it. And I also like the fact that you're not saying this is totally it. This is totally the cause.
No, so I like to caution a lot of patients, especially if they go, I personally don't like scaring people into doing stuff. So education's great, but what I have found with some consultants, they'll come in and say, if you don't get this done, then this is going to
Explain what you mean by consultant, because I know what you mean.
So I've had consultants come in, not to my office, in previous offices that I've been in, and basically say, this is what you have to tell patients. If they don't, and it got really extreme. They have said stuff that if you don't get scaling root planing, then you're gonna have fertility issues. And I was like, well, that's pretty extreme.
Or you said the opposite. If you do get it, you could be fertile.
Yes.
This cause of treatment will do this. If you pay for this, it begat that.
Yeah. Which I don't agree with. And I think
You don't agree with the fertility?
No.
Oh.
I just don't think we should oversimplify anything. So the body's very unique and it's very complicated. And to say there's a lot of factors, but I don't think just doing the deep cleaning is the one that's going to cure everything. It will definitely help because you want to control that inflammation.
Can I ask this question then? So if you have
No.
consultants that are, well, I have to ask this question because we don't have a follow-up. If you were dealing with these consultants and then you have this research that's talking about the correlations between oral health and heart disease, aren't they looking for a reason, these consultants, to push for someone to diagnose and then treat? If you have a consultant in your office, I'm only saying this because I've seen this. As I've said before, I was married to a hygienist, so sometimes I would be in that office just waiting on 5 o'clock to come, take someone home, get yelled at. But when that was happening, I would hear that, well, you need this because this is going to become this. So you're saying you can't really diagnose everything where it's going to go. So you're kind of I don't want to say it. You're treating patients kind of like your own pocketbook. You're diagnosing so that you can do fillings or you can do treatment because let's be honest, it's a business at the end of the day.
Yeah, but you need to do necessary treatment. And I mean, periodontal disease.
But how do you know the difference is the question. So if periodontal disease is something that doesn't go away, someone can't say I can cure you.
Sometimes what I, so people will have pocketing, and I've seen it in college kids. So the other thing we look for is bone level. So you do lose bone level when you have periodontal disease. Your gums will be inflamed. But sometimes I've had college kids who don't floss or brush, and so their gums are inflamed just because they're not flossing. But if you look at their x-rays, their bone levels are still good. They're at good levels. But then they might have pseudo pockets. So because their gums are inflamed, they might actually have a pocket because they're just they're swollen. They're inflamed.
But it goes back to they're not maintaining their
so
hygiene.
What I always recommend is giving them a chance to fix their hygiene. So if they're flossing regularly and brushing, that gum tissue will get firmer and it will shrink down, and then you won't have that pocket.
It can bounce back. Your gum tissue can bounce back for the most part.
Yeah. But if you have perio, I mean, there is more. It's much more involved. But sometimes I felt like things were not diagnosed in an ethical way because they just were like, hey, you have some pocketing. Let's not remember that you haven't brushed and flossed. Let's just call this, right. Let's just call this scaling root planing. And then once you have periodontal disease, it's for life. So, then they put them on this 3 to 4 month and they may not even had it. And I'm not saying that happens all the time, but I've seen that happen, and that was very frustrating for me.
I just think that it's interesting because, again, we've talked about the whole reason to find anybody in the medical field is that you're trusting your health in their hands.
Right.
So we talked about this might be 2 months ago, about the kind of family dentistry angle or locally owned versus the kind of chain. And it feels like to me that if you're constantly in the chain situation, it is we are going to diagnose because that's what we do. Right. We are going to find procedures to do. But periodontal could be one. If it's not something that goes away ever, you need to find somebody who knows how to treat you for the long term.
Right. And monitor it and maintain it.
Because it could lead, again, that excess plaque getting into your bloodstream can be terrible. I feel like this is the most technical we've been. Actually.
I know. It feels uncomfortable. I'm just kidding.
Yeah, I feel like we're very CNN right now, like we're getting into something. And you're very dialed in today, Phing. I like it.
Thanks.
Before we cut this off and go to break, I do want to just say that, again, this is the American Dental Association. Talked about this, the American Association of Periodontology. I didn't say that right.
You did periodontology.
Did I? Because that sounds like dinosaurs to me. Yeah. But this also was covered by the Cleveland Clinic. So these are not, they are saying they are connected, but they are not saying this.
It's not causal yet.
Right. Yeah. It's not end all be all. So I hope that answered Kevin's question. And if not, he can always hit us back on Facebook. I don't know if we can do too many shows in a row about this, but I think we've cover it.
Yeah, we've covered it a couple weeks ago.
And
months ago.
I thought that this was important because, again, one of the things this goes back to is you don't just look for reasons to put somebody in the chair.
No,
we've tried to differentiate what it's like to go to River Park versus another dentist who might have a car payment to make.
No, I mean, yes, it is a business. However, I want people to feel comfortable, and I want them to know that they can trust me. And it's important for me to treat them the way I would want my own family to be treated.
Do your kids actually go to you? You have 3 kids.
No, I send them to other.
Okay. Well, I think it's important to point out. You have your own family and you have a family practice. I just want to make sure your kids are going there.
Yes, they are.
Okay. And your husband too?
Yes.
All right. Why did you have to think about that?
No, he does, and his family does. I was thinking about my 2-year-old because he won't let me clean his teeth.
Really? He knows that you do. You do that for a living, and he's aware.
Yeah, but he does. It's like a parent. I'm still his mom, so he'd rather have someone else clean his teeth. But this kid, I tell you.
So who did? Like Missy has to jump in.
Missy has to jump in. But I mean, he's 2. What are you gonna do?
Yeah, just let him drink Mountain Dew. We did discuss in moderation. Mountain Dew is fine.
No. Yes.
We did discuss that. You said some candy and some Mountain Dew. We had that show like 3 weeks ago.
Yes, everything in moderation, but just brush and floss regularly.
I think brush and floss is a good place to take a break.
Yeah.
We're going to take a break, but you're listening to the River Park Dental Show.
I'm Dr. Phing Saurer, your dentist at Bridge Park. Have you ever been to a dental office and received bad news? Then you were told to see a different dentist with a different set of financial policies at an inconvenient location? At River Park Dental, once you become our patient, we won't ask you to see anyone else. My team and I are highly experienced and are proud to offer all services for you and your entire family under one roof. To learn more, visit us at riverparkdental.com. River Park Dental, where we practice tomorrow's dentistry today.
HouseTrends.com, the perfect place for you if you enjoy looking at beautiful homes and outdoor living spaces. Their stunning photos and articles focus on local Central Ohio residential building and remodeling projects with plenty of kitchen, bedroom, interior design, and landscaping ideas. You'll also discover exciting options in home design and furnishings. HouseTrends.com adds new content daily. Sign up to receive their online edition and check out past issues too. Go to HouseTrends.com and click on Columbus.
Are you tired of the recruiting and hiring merry-go-round? There simply aren't enough trained diesel mechanics in Columbus. And guess what? It's only going to get worse. I'm Tim Spurlock, president of American Diesel Training Centers. In short, we find, vet, train, and place quality entry-level techs through an intensive 12-week hands-on experience. We've partnered with some of the best transportation companies in Columbus. We'd like to partner with you. Find out more at AmericanDieselCBus.com. That's AmericanDieselCBus.com.
Hi, I'm Dr. Phing Saurer, owner of River Park Dental. My team and I provide tongue and lip tie releases with a CO2 laser for babies struggling to nurse. We understand how stressful this can be. To make it easier for you, we bill our fee to most medical insurances. That way you can focus your time on what's important, you and your baby. We are proud to be your local provider. To learn more, visit us at riverparkdental.com. River Park Dental, where we practice tomorrow's dentistry today.
Hi, this is Jeff with Meyers Jewelers. If you're in the market for an engagement ring and or wedding band, then let Meyers Jewelers be your one-stop destination for this bridal season. At Meyers Jewelers, we have teamed with some of the finest designers in the world. From Tacori to Hearts on Fire to Martin Flyer to Simon G, Sylvie, and many, many more. Along with our great selection of designer ring styles, we have a multi-million-dollar selection of certified loose diamonds as well. Come visit the family on Stringtown Road in Grove City and experience Meyers Jewelers.
Are you an outdoor person? Do you want to do creative work? Check out the job opportunities at Greenscapes Landscape Company. We are now hiring for our new Northwest location near Dublin. No experience necessary, just a great attitude. We offer great pay, health insurance, and a company matching 401k plan. Go to greenscapes.net for an online application or call Sandy at 614-837-1869. Greenscapes is an equal opportunity employer.
Hi, I'm Dr. Phing Saurer, your dentist at Bridge Park in Dublin, Ohio. If you aren't feeling confident and dream of a brighter smile, we can help. For $450, we can make your smile movie star white in just an hour in our office. Or we can make you custom fit trays and gel to take home for $125. If you need a quick solution, we offer pre-filled whitening trays that are just $30. A confident smile is on the way. We've got you covered. To learn more, visit us at riverparkdental.com.
They say it doesn't matter if you win or lose as long as you tried your best. But they probably didn't just get crushed by a semi-tractor trailer. You lost when you were hit. You need to win to get your life back. I'm Scott Elliott Smith, and I have over 35 years of experience protecting families. You don't do what I do for very long if you're not successful helping families get back on their feet. Visit us online at sestriallaw.com. Get Scott Smith. Get justice.
Hi, this is Mike Charles, owner of Charles Brothers Asphalt. To get your free seal coating estimate, call us at 614-870-7230 and trust our 17 years of experience to give you the highest quality seal coating at a price you'll love. Charles Brothers Asphalt, protecting surfaces since 1998.
Welcome back to the River Park Dental Show.
Doc, I wanted to get into something that you shared on Instagram and I think on Facebook. I saw that you shared it and I thought, perfect idea to use the radio show to promote this event.
Yes.
And then I took a screenshot on my phone, which we use to record this for Facebook Live. So I can't read it, but can you let people know this is just another thing that River Park is involved in the community?
I
Could you
have
let
to
people
read
know?
it now.
Yeah, that's fine. But you have to read it into the microphone.
Oh, okay. So we are supporting the Linda W. Danuel Foundation. So the reason why we're even we know about this is because Matt, her son, is one of our sales reps, and he helped build the practice. But it's an event to. I'm trying to look at this here. I can't read.
Yeah. Well, again, it is from an
cancer.
Instagram post.
Yeah.
Yes.
Yep. So, but there is a soccer camp this coming weekend. So when this airs, it'll be happening that day. And there's a walk and stuff. And it's just a fundraiser to
Is it a
raise
5K?
Awareness. I don't know. I think it's a walk.
5K is going
it's a walkathon.
as soon as the sun comes out. There's a 5K.
There's a lot of
every couple months.
5Ks. Yeah, there are.
You guys are involved in all these different community things. That's why when you share them, like I try to screenshot them, but we only see each other one time a week. So we can only talk about
There's
it.
a lot. So sometimes I have a hard time remembering, but I do like to support foundations.
But Matt did help in helping get the practice off the ground. So I think we definitely have to give him a shout out.
Yeah, from
Matt,
Patterson Dental.
That is like a big name. Patterson Dental. I've heard that name for 20 some years, at least, I think.
Really?
Yeah. Well, you got to remember, I was married.
Oh, that's right.
You're
married. I was like, why would you, a regular person, know?
Don't say a regular person. Why would an average civilian know about Patterson Dental? But I think what's interesting about that is those seem to be the relationships when you meet these sales reps, for equipment at least, that it seems like you have this bond with them.
Oh, yeah. No, so we work with Patterson, we work with Benco, and we work with a lot of reps, but Matt's one of my favorites.
So let's hope the other reps aren't listening to this and know they are like second.
No, there's two main ones that I work with. Jane is my other one from Benco, and we love her too.
Yeah, but Matt kind of got top billing today.
Yeah, because we're supporting his mother's foundation.
And again, I think you should point out that's this weekend.
This weekend at Otterbein.
Yeah, if you're listening on a Sunday morning, it is happening today.
Yes.
Is there a website that they can go to, or do they just kind of?
I think they can look it up at the Linda W. Danuel Foundation.
All right. Well, that's for you, Matt, and thank you for helping Dr. Phing and Ellen and Missy.
Yes, and Sarah.
And Sarah.
Yep, my wonderful, wonderful staff.
Sarah's fourth on my list. I've just not
She's
met her.
She's newer, so you might not. I don't think you've met her.
I saw the video of you dancing to Footloose as a practice. So I think, first of all, I have to point out that's probably the first Footloose related dental.
What did you think of my moves? I had to study it for about 5 minutes.
I could tell that being that you have 2 doctorates, that you look into everything, and I could tell you really worked hard on that.
Did it really look like I worked hard?
It looked like you. Listen, I haven't seen Footloose in probably 20 years, but it looked like you knew what you were doing.
I had to watch that video for at least 5 minutes before I can get some.
I hope there were no people waiting on hygiene checkups while you were doing it.
It was during our break. We like to have fun.
Well, I want to talk about the fact that so far the practice, I mean, you've had River Park open since January.
Yes.
Where are you guys at from a business standpoint? You're seeing a lot more new faces. Are you seeing some old faces that have finally found you again?
Well, we're starting to get into a recall, so we're going to start seeing people.
Explain what recall is. You're talking to a veteran.
Recare.
I know what that is.
Our recall. So when you're coming back for your 6-month cleanings or your periodontal maintenance, you're coming back.
Is it exciting? Because you're going to see those people back again?
Yeah, I like seeing the same faces.
Your face actually like perked up like, yes, I'm super excited to see these people.
I don't know, it's fun to catch up. Because I only see them every 6 months. So a lot of things happen and you want to,
But I mean, this is crossing a big milestone because we're almost through May, believe it or not.
Yeah.
So you're going to be open around the 6-month period here. How do you feel about where you are right now? I mean, you've got a radio show, so you're kind of making it.
Yeah, I'm
you're
really
a big
legit
deal.
now.
Yeah. But you're
giving out autographs left and right.
The part that I always tell people about you is that once that River Park complex is done, I mean, you're one of the first tenants in the area that can actually do things on a daily basis, other than the 2 restaurants that I've seen.
They're adding more, though, this spring. It's really cool.
More restaurants?
Yeah. Z Cucina, Italian place.
I think we could figure that part out.
Rebel, which is like I think you would like that because it's kind of like Chipotle.
Do they have a lot of bread? I love bread.
I don't know.
I'm just kidding. I can't eat that bread. We discussed that during the break.
Sorry.
Almost died of gluten intolerance.
And then Hen's Quarters. It's a southern place.
I feel like the thing's set up
delicious.
perfectly for you, though.
Yes.
Because people are going to have dirty teeth and they can come over and see you.
Yeah, we like to support the businesses too. So when you come to our office, then we offer gift cards to the newer businesses that are opening.
What's the place called? The Ram.
The Ram.
That
place is good too.
I was told to go find the Ram and then look catty corner and I would find your building.
Yeah, people said they don't know what catty corner is. Is that a?
I think it's like an old school. It might
Is
just
it an
be a
old-
Columbus
I don't know.
term, or maybe. Well, it means diagonally, as
Yeah.
Jim just said, but it's. I don't know. That's what I was told to look, but I still couldn't find you because, as I've said before,
Because we're on the second floor.
you're on the second floor, but the first floor wasn't done, which sounds
But it's
odd on the
going
radio.
to be, yes, Sweetwater.
What is that going to be?
Like a coffee.
Even better.
Yes.
People drinking coffee and those teas to stain the teeth, and they're going to come right upstairs.
Yes.
And you said you don't mind that.
No,
You're
never.
good with it.
Yep.
I have a feeling you're going to spend more time down there than people from there are going to spend upstairs, but we'll find out.
Well, I don't know. We have that Nespresso. That's still pretty good.
That is true, and it's free.
And it's free.
Yeah. It's still doing the Sonicare for new patients, or
Yes, that's an option for sure.
Does that come from Matt too? We're just
No,
gonna give
that's
shout-
from Philips.
Okay,
Sonicare.
just checking. So if Phillips we're plugging everybody today.
Yeah. I know.
That Sonicare.
A lot of people actually pick the Sonicare.
Well, Andrew was on the show as a patient, or I think you were on our other show, and
I don't know.
he bragged
To
about it.
protect people's privacy.
No. Oh, that's right. I'm not saying he was a patient, but he did tell me about the Sonicare. We'll put it
Yes.
that way. Why do people want the Sonicare? What's the difference in that?
I mean, it's a really good toothbrush. So, and it helps massage the gums really well. It gives you good cleaning. It's ultrasonic. It's just, I like it, so that's what I would recommend. But there's other toothbrushes too that are really good.
Did Rachel get one?
Yes, I can't remember. I'm not
like you to
up front,
take
and
hers
I don't
back.
know what.
I would like you to take yours back. That's the only request I have. I'll keep doing
Oh,
this.
Jim got one.
Jim got
Yeah.
one. Andrew, everyone. Madison will probably get one.
You think he'll pick that?
Here's the funniest thing that you said all day.
What?
Madison, who was on another show with me, a good buddy of ours, and he said, I'm coming in on the 29th. And you're like, I forget what you said, but something like, should I be excited about that? Like, it was such a punch in the nose. It was fantastic.
No,
He loved it.
He's nice.
He is nice, but it was so funny because I think he was like,
It was unexpected.
yeah. But I think he was excited because he wants that Sonicare. I think that's the only reason he's coming.
No,
Maybe.
no.
Andrew talked you up,
Well,
which is good.
yeah, but he's actually getting work, not a cleaning. So he
You
needs
actually
to...
can't tell me that because of HIPAA. I don't even know what you're talking about.
Gosh.
That's going to be it for this week. But again, I hope that I really feel guilty if we didn't answer Kevin's question, but I think we did.
I hope so.
Yeah.
But he can message me if he wants more information.
Yeah, the doc will always get back to you. Why don't you sign us off for this week?
So out of it. Thank you for listening to the River Park Dental Show. We'll see you next week.
You've been listening to a Morris Media production.